Hi, I'm Jessica Hall, TV radio personality. I'm sitting here with Dr. Nicole Waschak from Providence Holy Cross, and today we are discussing what to look in a perfect birthing center. So what is the first thing I should be looking for in a birthing center?
So first, the important thing is to find out where your doctor actually delivers at once you're comfortable and you've found an OBGYN. And then just, finding out about their reputation, finding out what, facilities, amenities, things that they have, things that are important for you for your birth experience.
So what would you say is the most important thing to make my birthing experience the most satisfying?
I would say knowing what your goals are going into it, what's important to you, knowing that ultimately everybody's goal is a healthy mom, a healthy baby, but knowing things that are important to you, pain management, how you want to labor, things you do and don't want, knowing those things ahead of time.
So how far do I have to be dilated to get an epidural? You said pain management, so that's the first thing I think of.
That is ultimately, I would say, up to your physician. I would say for myself, I tell patients that if you're able to sit up and get it, then to me you can get it till the very end because everybody labors differently, and even if you're 10 centimeters, that doesn't mean you're delivering right now. So if it gives you a few extra hours of comfort, then to me, if you're able to sit up for it, you can have it.
Okay, but it does wear off though if you get it too early on.
No,
is that true?
No,
that's a
constant
myth.
It is. It's a constant infusion. So there is a catheter type device or tubing in your back, if you will, that gives a constant infusion. So unless it's removed or turned off, you will continue to get the medication.
Oh, good to know, coming from the doctor. Okay. Do you guys have certain policies for if I wanted to give birth in a certain position? Or is it just what's safe for the child and myself? How does that work?
I would say it's mainly based on, the status of the baby and the status of the mom at the time. When you're in the early part of labor, or if you don't have an epidural, if walking around feels comfortable to you, we allow that. As long as baby looks good on the monitor and you're doing well prior to getting up and going to walk. Same thing, I would say, position of delivery is really going to be up to your physician and what their comfort level is.
So how does fetal monitoring work?
So we have two options here at Holy Cross for fetal monitoring. One is the traditional monitors on your abdomen connected to wires that projects the baby's heart rate, contractions on the monitor. We also have another option which is wireless, where the monitors are still on your abdomen but they're not connected to any kind of machine. So that gives you options as far as getting up, walking, moving around, but still being able to have the safety of watching the baby and contractions at the same time.
Now, do you guys have a limit per how many people can be in the room, like family members, husbands, friends?
We do. 3 is the limit, and the reason for that is safety, again, just because you get an entire team that comes in when you're delivering. So sometimes, depending on what happens at birth, the staff from the NICU can be in there. You have nurses for you and for the baby, different staff. So in order to make sure it's safe in the room and there's not too many people, there is a limit of 3 people.
With my first, I wasn't able to eat or drink anything for 24 hours. Like, the second I went into labor, I didn't have her until 5:30 that morning, so I wasn't allowed to have anything. Why is that?
The reason that we don't, or some physicians don't allow you to eat during labor is, one, trying to avoid you getting sick when you get into the active part of labor. When it really starts to hurt, we tend to have women that get sick, so we're trying to avoid that. But also, in the chance that anyone might need a C-section, we would really like to not have a full stomach if they need surgery, just because there can be risks with that.
Well, yeah, so do all women, because probably, they want to hide it before you even see it, poop on the delivery table?
Not all, but
I did. But I thought I wasn't supposed to see that.
Well, I tell patients,
clean it up fast enough.
I tell patients that if you poop, you're using the right muscles, because it's the same muscles you're supposed to be using for pushing, so that means you pushed well.
But I remember focusing on that, giving birth, and I was like, oh my gosh, yeah.
No. Yeah, we try and
women have that question though. Seriously, they all want to know, they're just not asking, and I guess
not everybody does, but I tell patients, those are the muscles we want you to use. That's what we tell you to push, like you're pooping almost. So if you do, that means you're pushing well. You're using the correct muscles that we want you to use.
Good. Okay. All right, that makes me a little happy. So my first time around, they told me that I may have to share a postpartum room, and that was one thing I did not want to do. Come on, you don't want to get labor and then have to go to post,
Yeah.
So how do you guys kind of do that?
So every room here, from labor, where you labor and where you deliver, and your postpartum room, are private. At Holy Cross, there is no sharing of rooms with patients. No.
That's a plus. Because that was one thing that really turned me off, knowing that I would have to share a room with someone else.
Right.
you know.
Yeah. The only area that's really shared, if you will, by curtains, and it's a limited time that you're there anyway, is triage. But once you get admitted for labor and delivery, you have your own room, and same thing for the postpartum part.
How often do the nurses come in and check on you after you give birth? I just remember my first labor, I had so many nurses, which were fantastic, but they would come in quite a bit just to check,
Yes.
you know, to see if I dilated or to check the heart rate, and it felt like nonstop. How many nurses do you have per room or per patient? So
when a patient is in active labor, from what I understand, it's a 1-to-1 ratio. So one nurse, one patient, so they can focus, all their attention on that patient. If a patient is in induction where something might take several hours to get into the active phase of labor, I believe they can be a 2-to-1 ratio.
Okay. I took a tour earlier of the hospital, and now that they don't believe the baby should be away from you at all.
Correct.
So how exactly does that work? So after you have the baby stays with you. They come and check on the baby?
Correct. So as long as everything is okay at the time of delivery, baby goes straight onto your chest or your abdomen, and they do the immediate skin to skin for baby's warmth and temperature regulation, feeding, things like that. And they like to keep baby with moms just to help with like initiating breastfeeding if that's how the mom chooses to feed, as well, like I said, as well as temperature regulation, bonding, that type of thing. So baby really does stay with you for the majority of the time.
And how long would I have to stay after, being that this is my second child and things go smoothly, hopefully?
Yes.
How long would I have to stay here at the hospital to make sure that the baby and I are perfectly fine to go home?
So vaginal deliveries can stay up to 2 days, if everything's uncomplicated and going well. Some moms, if this isn't, like you said, your first baby and everything is okay, you can go home at 24 hours or 1 day later. C-sections are a little bit different, just because of the recovery from a surgery. They can go home at about 2 days, maximum of 4 days if they need to stay.
Do you guys serve good meals here?
The cafeteria is not bad. From the hospitals I worked at, it's really one of the better cafeterias. So I would say, yeah.
And do you also have lactation consultants that come in to your room and they kind of work with you and just make sure the baby's latching?
We do. All of the labor and delivery nurses and postpartum nurses are trained in it as well. So they're really good about helping moms. But we do have lactation consultants that can, help initiate breastfeeding and help with any problems you might have. And they're a fantastic resource to have here.
That's great to know. So how does your hospital promote mother-infant bonding?
So immediately after the baby's born, as long as baby's, healthy and everybody's doing okay, baby goes straight to the mother's chest or abdomen, skin to skin, for temperature regulation, things like that, to get, breastfeeding initiated. And they also like to keep the infants in the room with the mom and the family for the entire duration of their stay here.
So I'm almost due, like pretty much any day now, and I want to pack my bag to go, the whole...
Yes.
I don't want to waste my time. I kind of screwed up the first time around. You've seen it. You know exactly what to do. I mean, you're pregnant. What is the necessities that I need in my overnight bag to the hospital?
The nice thing is the hospital provides a lot of the things that you need, which you may have experienced your first time around. So really the things that you might need are comfortable pajamas for after you deliver, outfit for the baby to go home in, car seat.
What about, I can't remember. I think you forget your first time around. I know this is your first baby, but I forgot labor, birth, newborns. I forgot it all. Yeah. So do I have to bring, because I did not realize that I would, be needing pads, like really thick ones after birth.
Yes.
So do you provide those, or would that be
provided?
They are provided.
So while you're in labor, the gown is provided to you, and then for the postpartum period, the fancy mesh underwear and the big pads are provided to you, so you wouldn't need to bring those.
So you provide diapers and
diapers, wipes, pacifiers if that's what you're using for your baby.
Okay, so pretty much you're saying all I need to pack is PJs and an outfit for the baby and a car seat.
Correct. So
what about toothbrush?
Yeah, you can bring your own, but they have them if you don't.
Okay, good to know. All right, well that gets a lot more simple, so I appreciate that.
Yes.
Can you labor and deliver in the same room?
Yes, you do here at Holy Cross. So you start out in the triage room when you come in to determine if you're in labor or not. And then once you're admitted, you move to a labor and delivery room. So that your entire labor goes on in there and you deliver in there as well.
Do you have an OBGYN 24 hours a day on call here at the hospital?
So we at Holy Cross have a program called the Laborist Program. So there is an OBGYN here at the hospital, physically in the building 24 hours a day. which is a really nice thing to have, because even if, a patient's doctor is at home just a few minutes away, if something were to happen, we have somebody that's here in the building that can help at any time.
What if I had a high-risk pregnancy? How would you handle myself and if I had any complications?
So Holy Cross has a special unit as part of the labor and delivery floor called the antepartum, or its high-risk unit, where patients can go long-term and be watched closely, throughout their pregnancy. There's also high-risk doctors that we consult to come in and give their opinion about the pregnancy and help us with management and things like that. The nice thing is that Holy Cross has the ability to take care of babies from the point of viability, which is basically the point at which a baby can survive outside of the uterus, which is about 24 weeks. The reason we have that ability is because we have a level 3 NICU, which can accommodate babies from that gestation or that age, if you will, and beyond.
What is the difference between the level 1, 2, and 3 in the NICU?
The difference between the different levels of NICUs is the gestational age or age of the baby at which they can accept them and provide them care in that NICU. So, some, like a level 3 NICU can accept a baby, like I said, from the point of viability or about 24 weeks and beyond. Some, they need the babies to be a little bit older just because of the resources they have might not be as advanced.
What's your take if someone wants to try a VBAC?
So Holy Cross, because of the laborist program that I previously talked about, meaning that there is an OBGYN in the building 24 hours a day, as well as 24-hour-a-day anesthesia, so an anesthesiologist. We have that option for the VBAC, or the vaginal birth after cesarean section, to allow moms to labor here and attempt to have a VBAC. So that is an option here at Holy Cross, which is nice.
If I were to give birth here, how would my medical records be stored? Are they private?
All patient records are private and confidential. Our record system that we have here is an electronic medical record system, so everything is in the computer, everything is password protected. Only the people that are caring for you directly have access to your records.
Why should I choose Providence Holy Cross for my birthing center?
Providence Holy Cross has received a lot of recognition in the last few years, but most notably in 2017, they received the Health Grades Award for Excellent and Superior Care for Labor and Delivery. They also have a magnet designation, which means we have some of the top nurses in the nation. And overall, we just provide quality, compassionate care, making sure that we treat, every patient that walks in these doors like they're our own family and how we would personally want to be treated.
I'm almost 40 weeks pregnant. With my daughter, I went almost 42 weeks.
Okay.
I'm not going that long again. What is your limit? Say I wanted to get induced. How far along do I need to be induced?
Based on current medical recommendations, we recommend that a patient be at least 39 weeks, so at least 1 week prior to their due date before we induce them for non-medical reasons. Patients can be induced sooner than that if need be, if they have medical indications to be delivered.
For me, my baby's Wayne. He's huge. At 35 weeks, 4 days, I had an ultrasound. He's over 7 pounds. The doctor doesn't want me to go too far along because I don't want a C-section. Is that true? Like, the bigger the baby is and I can't necessarily push him out, might make me go into a C-section?
There are a lot of factors that go into whether or not a patient requires a C-section. It's not necessarily based on baby size. It's about how your labor is progressing, if you've given birth before, things like that. So it's not, size doesn't have to be the only factor that plays into whether or not you're going to need a C-section or not. So most doctors would give a patient, like yourself, a fair trial of labor to see if you're able to do it on your own.
So my first baby, I did tear a little, and I'm just thinking, okay, she was 7'7". Now this baby is going to be a lot bigger, says the doctor. Does that mean I'm going to tear more?
Every labor is different, every pregnancy, every birth is different, so it doesn't necessarily mean there's going to be a bigger tear or that you'll tear at all. So, it's hard to answer that question, but
so you're saying I'm already stretched? I'm already stretched enough, so it's going to just come out?
It's possible, but it doesn't necessarily mean that you'll have a tear or, that we can really say based on size that, if you will, or how big it will be.
Well, you can stitch it up, right?
That's right.
That's true. That's okay.
It's all right. Everybody does it. It's like the pooping thing. Almost everybody.
Well, these are questions. Yeah. These are. I think real questions. No one really told my husband and I what to expect. The first time around. I don't think anyone actually probably can. But I did. Give birth to my daughter, and when she first came out, I barely saw her. It was just such a blur to me. But my husband kind of panicked for a second because she had such a cone head.
Yes.
And eventually, within minutes, it was leveled out.
Yes.
But is that
It's very, very common.
Oh.
It's just from the babies.
It scared him. Like, it really did.
It's just from the babies going through the birth canal. Their heads kind of mold and shape to, conform to your pelvis. So
He said it was like a cone, like an actual cone.
Yes, and some are more severe than others, and more alarming, if you will. But usually within 24 hours, that swelling and that, shaping of the head does resolve. So, but it can be a little bit alarming when they come out. But it is perfectly normal, and it allows them to move through the birth canal.
Yeah, I felt like at the second she came out, I did have that, the skin to skin for a second. I mean, everything was such a blur, but I just remember it kind of being like a NASCAR station.
Yeah.
All the nurses were in there taking her to one spot to the next. I mean, I am impressed on how well, everyone just acted so fast and made sure the baby was perfectly fine.
And that's a big thing with Holy Cross is we work together as a team. Everybody has a role in the room to make sure, healthy mom, healthy baby.
Yeah.
One of the things as part of the baby bonding is that we try not to do that station, moving as much now. We try to keep baby with you as much as possible. They really delay like the bath of the baby and the weighing of the baby for a couple hours now to allow you to bond. So, as long as everything's okay, baby's now staying with you more so than moving around to, different stations. But if that does, is a necessity, then, everybody kind of jumps into action and knows what their role is.
Oh, it was so quick, but everything was so good, and then once I had the baby on me, it was,
Yes.
oh, we're doing it again. Well, I'm doing it again. First baby.
First.
I'm going to deliver. Thank you, Dr. Waschak. You cleared the air on so many questions I had about choosing a birthing center.
It's been my pleasure.
For those of you who are watching, hopefully this was helpful. For any questions or concerns, please check out the website.